In our first section of otosclerosis, we will talk about the etiology. In this section, we will talk about the anatomy of labyrinth, and also we will talk about the overview of otosclerosis disease. So first, the anatomy of the labyrinth. What is anatomy? Anatomy is the study of the basic structure, and labyrinth is the inner ear. The other name for the inner ear is labyrinth. So in this, we will talk about the anatomy of the inner ear or the labyrinth. If you see the gross anatomy of the inner ear, this is the inner ear or labyrinth, and this consists of snail-shaped structure. This is the cochlea. And then we have canal of cochlea or the cochlear duct. So this is cochlea, snail-shaped structure. Then there are two structures known as saccule and utricle. These are the two structures which are present in vestibule. So this portion is known as the vestibule of the labyrinth. Then we have semicircular canals. There are three semicircular canals or ducts. So this is the just the gross anatomy or the basic structures that constitute the inner ear or the labyrinth. So we have otic, labyrinth. Otic is for ear and labyrinth is the inner ear and the other name used for inner ear. The labyrinth or inner ear roughly is divided into two main parts. We have the bony labyrinth and the membranous labyrinth. So bony labyrinth and the membranous labyrinth. And the bony labyrinth is the outer rigid part. Since it's bone, it's the outer rigid part, and it contains all these structures, cochlea, and then the semicircular canals included in the bony labyrinth. And inside we have the membranous labyrinth. So membranous labyrinth or endolymphatic labyrinth. This contains utricle, saccule, cochlea, semicircular ducts, and endolymphatic duct and sac. So all these structures, saccule, utricle, cochlear duct, semicircular ducts, these are the parts which are included in the membranous labyrinth. The other is the bony labyrinth. So labyrinth or inner ear is roughly divided into two parts, bony labyrinth and membranous labyrinth. Membranous labyrinth is also known as endolymphatic labyrinth, because endolymph is the fluid that flows in this membrane labyrinth. So these structures, there is a fluid that flows in this known as the endolymph. That's why it's also known as endolymphatic labyrinth. So bony membranous labyrinth or endolymphatic labyrinth. Then we have also periotic labyrinth or perilymphatic labyrinth. Peri is the fluid that surrounds the labyrinth, around the labyrinth. So that's the perilymphatic labyrinth. And endolymphatic is the fluid that flows inside the semicircular canal or ducts. Then the third structure, otic capsule. Otic capsule is also known as the bony labyrinth. Bony labyrinth has the part is made up of these three layers. We have endosteal layer. Endo means inside. Osteum is for os, is for the bone. So endosteal. Then we have enchondral from the cartilage and chondral layer, and then we have periosteal layer. Peri is around. So your bony labyrinth is made up of 3 layers: endosteal, enchondral, and periosteal. Endosteal is the innermost, enchondral is in the middle, and then periosteal is around. So now you can see that labyrinth or inner ear is made up of 2 main parts: membranous labyrinth and bony labyrinth. Membranous labyrinth has all the utricle, saccule, cochlea, semicircular canals, ducts, and sacs. All these. And then the bony labyrinth is made mainly of 3 layers. We have endosteal layer, which is the innermost. Then there is enchondral layer, and then around that is the periosteal layer. Next, what is otosclerosis? It's the disease of bony labyrinth. Sclerosis is the term used for hardening, and it's a misnomer actually, because mostly the replacement, the bone that forms is more like spongy type, it's spongiotic. So the other name used for otosclerosis is also otospongiosis. So it's the primary disease of the bony labyrinth in which one or more foci of irregularly laid spongy bone replace part of dense enchondral layer of bony otic capsule. So in this, the bone is formed which is more of spongy nature, and it replace or it cause obstruction. So it's the growth of the bone which is more of a spongy type. So instead of otosclerosis, the other term used for this is otospongiosis. So one or more foci or areas of spongy bone replace normally dense enchondral layer of bony otic capsule. So the actual bone of otic capsule is replaced by spongy bone, and that spongy bone can cause obstruction and can lead to conductive deafness besides other complications or problems. So this is the diagram of the whole ear. If you see, this is the external ear auricle, ear canal, and this ends at the tympanic membrane or eardrum. After that, there is a middle ear. Middle ear has 3 ossicles or 3 bones. We have the incus, malleus, and then the stapes or stapes. So incus, malleus, this is the head of the malleus. Then we have incus bone, and this is the stapes or stapes. This is the middle ear. After that, there is the inner ear or labyrinth, and if you see in this is the otosclerosis. So this is the bony growth that occurs in the close to middle ear. You can see it's mainly involved the foot plate of the stapes, which is the ossicle. So this is the diagram that shows otosclerosis. This is the otosclerosis. Now, what are the causes of otosclerosis? The different factors can lead to the otosclerosis. We have the anatomical basis. Anatomical basis that areas of cartilage rest to form a new spongy bone. So slowly changes occur in the normal cartilaginous area, and that leads to changes, spongious changes, and that leads to formation of otosclerosis. Then other factor, race is important. Otosclerosis occur more commonly in the white race than any other race. So white people are more commonly affected with otosclerosis. Sex, females are affected twice as often as males. So otosclerosis is also common in females and white race. Age of onset of otosclerosis starts between 20 and 30 years of age. Then other factors, pregnancy can lead to increased incidence of otosclerosis, and there is another syndrome in which one of the feature is otosclerosis besides other bony involvement. So this is known as Van der Hoef syndrome. Then viral infections, especially viral infections, RNA related to measles virus. So otosclerosis is also common in patients who have measles, especially related to the RNA, because this virus is RNA virus. So RNA related virus of measles is associated with otosclerosis. So otosclerosis is the formation of bony formation close to the middle ear, mostly in the petrous part of the temporal bone. That is the portion that's mostly involved. Instead of it's not a sclerotic change in the bone, it's mostly the spongy changes in the bone. So it's also known as otospongiosis as compared to otosclerosis, and it's very common in the white females as compared to any other race, and some anatomical factors can lead to otosclerosis also. Age of onset is 20 to 30 years, so it's not a disease of old age, it's a disease of young age. Pregnancy can aggravate it. Another syndrome known as Van der Hoef syndrome, it's present in that also, and measles is associated with otosclerosis also. Heredity plays an important role. So autosomal dominant trait with incomplete penetrance and a variable expressivity. So it's autosomal dominant disorder, and it's also congenital genetic, and it's associated with heredity disorder. So all these factors can lead to otosclerosis. So that was all about the etiology and overview of otosclerosis. Thank you for watching sqadia.com.